It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show. It's Expresso on SABC3. It's Tuesday, Medical Tuesday, and the 1st of October marks the beginning of Breast Cancer Awareness Month. This was created in order to raise awareness and raise funds for research surrounding the disease. And breast cancer has become one of the leading causes of mortality amongst women globally. And here to unpack everything we need to know about one of the most common types of cancers is trusted medical professional Dr. Justus Apfelstadt. And of course, our lines will be open if you have a comment or a question, so feel free to call us. It's 021-430-9881. Good morning, Doctor.
Morning, Zoe. Morning, Katlejo. Morning, viewers.
Good to have you here. Good to have you as we discuss this very important topic that is created, or I guess there's awareness around it throughout the month of October. So first of all, what is it that causes breast cancer?
We now know, except that breast cancer largely is a lifestyle disease. The typical culprits are obesity, lack of exercise, and alcohol abuse, which have seen to it that we see a large increase in breast cancer incidence, not only in this country, but worldwide.
Yeah.
As you mentioned, it's the most common cause of female cancer mortality worldwide, globally.
Well, that's quite scary that that's the case. Now, doctor, as a woman, you're always told how to do the self-examinations, going to a clinic, having your regular checkups. But what are some of the symptoms other than the potential lumps associated with breast cancer?
Still, the lump is the most common presentation. We would like to change it to a presentation that breast cancer is discovered at breast cancer screening, at mammography or ultrasound.
Yeah.
Okay.
And as it stands right now, is there a cure for breast cancer?
Yes, early detection is a very important cure, but also on the therapeutic front, we are making good strides.
Yeah.
That, as a matter of fact, as we're seeing it, the mortality of breast cancer has halved over the last 10, 15 years in the so-called civilized world. You can have your doubts about this when you're looking at Trump, but otherwise it's okay.
Yeah.
Also here in this country, we've seen a large decrease in the breast cancer mortality. We have figures from our own team that 90% of all women that we diagnose with breast cancer survive long-term.
Well, we would love to hear from you, so feel free to call us if you have a comment or a question around breast cancer, 021-430-9881. I think a question a lot of ladies would like to know is how often should you be doing the self-examination?
I think normal women without any kind of increased risk factors should do the self-examination once every month after their periods. If they are premenopausal, if they're postmenopausal, that means they don't menstruate anymore, perhaps on payday or on the full moon day. But once every month, look for lumps.
Yeah, okay. Very, very important stuff. All right, as we said, our lines are open, 021-430-9881. You mentioned earlier on, Doctor, that lifestyle habits like alcohol abuse or excessive use of alcohol, lack of exercise contribute to as one of the causes, or some of the causes of cancer. But what about genetics? How big a role do those play in as a cause for breast cancer?
It's actually very exciting at the moment to be in this field of practice, because we have seen initially in 1994 the big breast cancer genes 1 and 2 were discovered, but they are affecting only about 5%. That means 1 in 20 breast cancers. We now know that there is a slew of other cancer-causing genes, but that have not such a high penetrance, as we call it. That means that patients who have these abnormalities have a breast cancer risk lifetime of 1 in 3, whereas in the BRCA1 and 2, it's virtually 9 out of 10.
Okay.
Then now we are even further going down the line. We can identify genes in your body that change metabolism, that give you a moderate risk increase of breast cancer. And these genes, you can actually, the effects of these genes, you can actually counteract and therefore move into prevention of cancers and a healthier lifestyle.
Okay.
All right.
Well, Dr. Justus is going to be hanging out with us, so do give us a call if you have a comment or a question. We are talking breast cancer awareness, so perhaps you've got a comment or a question. Our number is 021-430-9881.
All right, we continue our Medical Tuesday chat today. Of course, the 1st of October marking the beginning of Breast Cancer Awareness Month, and that's why we've enlisted the assistance and the knowledge of breast and thyroid specialist surgeon Dr. Justus Appelstadt to unpack breast cancer for us. And earlier on you mentioned, Doctor, that lifestyle choices are some of the major causes of breast cancer. So it means that to a large degree it is preventable. So exercise, the lack thereof, is one of those causes. How much exercise is sufficient to reduce your risk of developing breast cancer?
We say about 4 hours of strenuous exercise means heart should be racing, sweat should be running. That would decrease your breast cancer risk by about 30%. 1 in 3, that is a major influence. Not only that, also after the diagnosis of breast cancer, if you exercise regularly, your risk of the breast cancer returning is lowered by about 1/3. And that is about the same effect as chemotherapy or hormonal therapy would have.
Wow. So wait, 4 hours of strenuous exercise per week, per day,
Per week.
per week? Okay, thank you.
That's
Where
also,
is it per
that's
day?
doable.
Just needed to make
That's
sure of that.
just doable.
And then the other thing as well, you mentioned alcohol or excessive alcohol usage. So how do we work around that? How much is too much? How much is enough?
Okay, between a teetotaler and a full-blown alcoholic, there lies a breast cancer risk increase of about 50%. So it's gradual and it's quite proportional to how much you drink.
Yes.
So we're in the Western Cape. We have to have our wine. 1 glass per day is healthy, but beyond that, we should rather not do it.
Be careful. Be very
Yeah.
careful.
Be careful. Now, Dr. Justus, I wanted to know in terms of the different types of breast cancer, because you often hear, you know, people always just talk about breast cancer. Is it just that, or are there various degrees of it?
We now distinguish 4 main types of breast cancer, and they are defined according to the response to treatment. Number 1 is the so-called luminal cancers, luminal A, strictly hormonally dependent. Chemotherapy won't work, biologicals won't work. Surgery and hormonal treatment are the mainstay. Number 2 are luminal B cancers. We'll come to that later. Number 3 is triple negative, no hormone receptors, fast-growing tumors, responsive and curable by surgery and chemotherapy. Number 4 are the HER2 cancers, which are treatable by chemotherapy and biologicals and are curable by those 2 plus surgery. Last one is luminal Bs. It's a mixture out of all of the above.
Okay.
Once again, luminal A, long-standing hormonally dependent, 40% of cancers, the others 20% each.
Okay.
We've got a caller on the line, our first one this morning. Thank you very much, Rizan, for giving us a call from Kales River, I believe. Good morning. Kraaifontein, excuse. Good morning, Rizan.
Hi, good morning. I'm calling from Kraaifontein, yes.
Excellent. What is your question?
Yes, I've had fluid coming out of my right breast since last December. And about 3 months ago, I went for a mammogram. They haven't found anything, but just a few lumps under my my left armpit. And now the fluid turned into blood and sometimes green stuff coming out. Should I be worried and should I go back?
All right,
Okay.
so would you like to answer that?
Difficult to understand, but I understand that there was a lump under the arm and she had a mammogram, which is the right thing to do.
Yes.
If on the mammogram is nothing and the breast is nothing, the lump should undergo examination by a specialist, and this is usually a lymph node, and a reason should be found why that lymph node is there. There are varying reasons.
Okay.
That can be inflammatory, that can be cancer, that can be anything. Go to a doctor, have it examined, aspirated,
Okay.
diagnosed.
And one of the things she also mentioned that there was a discharge from her breast. So is that something to be worried about? That was one of her questions.
The answer to that is ja nee, good old Afrikaans saying, and discharge from the breast can occur under various circumstances. Only when it's spontaneous, that means the patient should not press on it to provoke it, then it becomes medically interesting. We then do a mammogram. If the mammogram and ultrasound do not show any pathology in the breast, it's a purely cosmetic problem and requires a surgical treatment, small little operation that will take care of it.
Okay.
Wow, Dr. Appelstadt, thank you very much for joining us. We're going to keep you sitting there because there's so much more to unpack and that, of course, we're interested in, and, of course, that you are interested in as well. So give us a call on 0214309881 as we explore a little bit more about breast cancer during this month of October, which is Breast Cancer Awareness Month.
It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast show on this Tuesday morning, the second day of October. Yesterday, the first marked the beginning of Breast Cancer Awareness Month, and that's why we have our expert breast and thyroid specialist surgeon, Dr. Justus Apfelstadt, here to help us unpack what breast cancer is all about so we can create more awareness, educate the nation out there about this very important health matter.
That's right. Well, Doctor, earlier you touched on the different treatments that go along with the different stages of breast cancer or the different types of breast cancer. But can we unpack it a little bit more? Once you're diagnosed with breast cancer, what are your treatment options?
Right. There are in principle three areas that you have to cover. Number one is the breast. Number two are the lymph nodes under the arm. And number three is spread elsewhere. Because breast cancer can spread via the bloodstream relatively early in the disease to faraway organs. So for the breast, we've got local treatments, that is surgery and radiotherapy. And we've started individualizing these. We can now go from a simple tumor excision to a complete mastectomy with immediate reconstruction and all different types in between, adapted to the cancer, to the patient's breast, and to the patient's anatomy. Radiation therapy is like X-rays. It improves local control. That means on the chest wall. It doesn't do much else. For the lymph nodes, we have de-escalated therapy. And for most of my patients, we nowadays do a so-called sentinel node biopsy. We remove only one lymph node and then only rarely move on to remove all the lymph nodes, where that was previously standard. As to what concerns systemic treatment, that works throughout the body and covers these small disseminations of the cancer that we cannot discover by any form of examination. We give either hormonal treatment, chemotherapy or biologicals, and sometimes combinations of those.
Okay. Yeah.
Yeah, we do have a caller on the line. Good morning, Anonymous. What is your question?
Hi, good morning, team. I would like to know from the doctor, about 4 months, my breast started swelling a heck of a lot.
Okay.
And then it started to go down, and now I've got soggy breast, but I don't feel any lumps in it. So, can the doctor please explain what's wrong?
All right, doctor.
Okay, we are concerned about breast swelling, especially if it's unilateral, because it may indicate the presence of breast cancer. So your breast should be examined by a physician interested in breast disease and seen whether this is due to hormonal changes, which can happen, for example, in menopause when cycles become irregular, or whether there is something seriously wrong.
Okay.
Yeah, so there's definitely enough of a concern to go and see a
warrant
specialist to have an investigation done of that. All right.
Okay.
Well, the puppies have just decided to join us.
Frenchies.
Thanks, guys. Here they are. All right, we're going to keep Dr. Apfelstadt here for one more segment. Please give us a call if you have any questions, 0214309881. But right now, it is on the half-an-hour mark and time for the news headlines.
Only you can make my day.
Well, it is October, which is also Breast Cancer Awareness Month. We are joined by medical professional Dr. Justus Apfelstadt, who is answering questions if you have any around breast cancer. So feel free to call us. That number is 021 430 9881. Now, Doctor, earlier we spoke about the different treatment options around breast cancer. How do you know your treatment is working?
As a matter of fact, we know whether it has been working only if you survive and die of other causes, and that's preferably not the treatment.
Okay.
All right. I've said that about 90% of cancers treated by us will be cured. They will survive long term.
Okay.
Now, how do you actually figure out which is the best treatment for you? And I think the most important influence is where you're going to be treated. And the choice of treatment center has been shown in studies to reduce the mortality of breast cancer, simply choosing the right place to go to by about 60%.
Sure.
That is an effect bigger than any chemotherapy, hormonal therapy, or anything else except for surgery. So how do you go about choosing the right center? It should be a center. The first thing that you should ask when you have been diagnosed with breast cancer, how many cancers have you treated? And how many cancers do you treat per year? And a good guideline is about more than 100 breast cancers treated per year by that treatment team, because it must be a team consisting out of medical oncologists, a radiation oncologist, a surgical oncologist, and preferably a plastic surgeon. That whole gamut of treatment options can be offered. If they treat more than 100 new cases of breast cancer per year, then they usually have some sort of specialization in it. They go to international congresses. Then you can be sure that you have usually the best treatment options.
Okay.
But it's also very important where you feel comfortable, whether people take time to explain to you the treatment options, why, the rationale. If you're not feeling comfortable, go elsewhere for a second opinion. And that should give you a good background where to go for treatment.
Okay.
We've got a caller on the line. This is Anonymous, I believe. Anonymous, good morning to you. What is your question?
Good morning. My question for the doctor very simply is... Hi, can you hear me?
Yes, we
Yes,
can
we
hear you
can.
perfectly.
Oh,
Go ahead.
okay. You're looking beautiful today and your painting skills are excellent.
Thank you.
I want to know from the doctor about male breast cancer. There seems to be this myth that breast cancer is reserved for women. However, I have come across many incidences of men who had to have prosthesis and things put in because they have male breast cancer.
Okay.
When they come out of hospital, then they've always been to hospital for something other than cancer. Can we just ask doctor to enlighten us about that a little?
Thank you very much.
Thank you for that call, Anonymous.
Male breast cancer is actually not a public health problem because it's so rare.
Okay.
And just to give you an idea, for every 100 women I see with breast cancer, I see half a male. And that's not a lot. In principle, male breast cancer is treated the same way as female breast cancer, and we will not go into detail, we've discussed this earlier. But male breast cancer is very interesting for me from another point of view, because if a man suffers breast cancer, then we usually have a genetic predisposition, and then I'm very much interested in looking at the women in this family. So that is where the importance of male breast cancer lies for me as a breast cancer interested doctor.
If we could quickly, I know we're running out of time, but talk about what happens after treatment.
Yes.
About 9 out of 10 women treated by our team will survive long term. It's therefore imperative that we manage that long-term survival, because cancer therapy leaves quality of life issues. Just to give you an example, hormonal treatment for breast cancer will, in all likelihood, make a premenopausal woman postmenopausal. And that is quite a severe intervention. It is curable in many instances, but then how do we deal with the effects of menopause in a young woman? Chemotherapy often leaves women with what is commonly termed chemo brain. We have to manage these long-term effects, because what is it worth to have long-term survival if the quality is poor?
Okay.
And therefore we are going more and more in post-cancer therapy, quality of life management.
Yeah. Dr. Afasha, thank you very much for joining us for the enlightening conversation, certainly very educational, and I hope that you found it to be the same as well. And I think at the end of the day, prevention is better than cure.
Yes.
So those monthly examinations, so important. Get yourselves screened as soon as possible. And if you suspect anything to be wrong, do go and see your medical practitioner or specialist as we are creating awareness around Breast Cancer Awareness Month during the month of October.